This training resource will provide you with comprehensive first aid awareness, which you must understand is not a substitute for becoming a properly trained first aider through an officially recognised first aid training course. You should have at least one formally qualified first aider on duty on every shift. It is vitally important that you do not attempt to give any first aid that you have not been formally trained and certificated to do by an appropriately qualified first aid training provider, for example St John Ambulance or the Red Cross. The primary purpose of first aid is to save life, preventing the casualty from becoming more ill or injured until the emergency services arrive. Following on from that, the secondary purpose of first aid is to limit negative consequences of the illness or injury. You don't have to have an official first aid qualification to be useful in a first aid situation. This is one major advantage of being first aid aware, a benefit of this resource. Even if you're on your own when an incident occurs, knowing what to do could save a life. For example, finding out the casualty's name if you don't know it already, talking to them, reassuring them that they will be fine, looking for any obvious injuries, remembering any odd behaviour by the casualty, being aware of how the casualty has been responding to you, remembering what happened if there was an accident which you were witness to. Giving as much of this information as you can to the first aider or emergency services when they arrive should help them to give the correct treatment. If a first aider is treating someone and they know you are aware of good first aid practice, they can have you help them in useful ways, including, for example, controlling bleeding, fetching equipment, making the surrounding area safe, protecting the casualty's personal belongings which reassures them, supporting a limb, talking to the casualty to reassure them, telephoning for help from the emergency services. Anyone working in a health or social care setting needs to know your organisation's accident procedure and follow it when an accident or incident occurs. Likewise, whilst anyone can call the emergency services in an emergency, your organisation may have a policy about this. Check. If you are sent to call for an ambulance, dial 999. The person who takes your call at emergency services will take charge of what they need to know from you. For example, whether you only need an ambulance, what has happened, information about the casualty, such as their age, any existing medical conditions, the full address of where the situation has occurred, your name, the telephone number from where you're calling. As soon as the emergency services are on their way, tell the first aider in charge of the situation, who will tell the casualty, which reassures them. Your accident procedure should also address use of your accident book. Any accident or incident, no matter how trivial it may seem, must be recorded in your accident book. You can never tell how serious an injury may turn out to be later. Furthermore, an incident, injury or accident involving a client must also be recorded in their care plan. An entry in the accident book should include at least the time, date and place of the incident, the name of the person or persons involved, details of the accident or incident, what, if any, first aid was given, whether the incident resulted in a doctor or hospital visit, the name and signature of the person filling in the accident incident book. There has been a move away from the traditional ABC approach: airway, breathing, circulation, to what some first aid training organisations are promoting as the DRAB procedure. DRAB, D-R-A-B, being D, danger, R, response, A, airway, B, breathing. Danger. Check the area to make sure that there is no further danger to the casualty, that you are not in danger nor anyone else. Response. Can the casualty respond to any stimulus, such as you talking to them? Airway. Is their airway open, in order that they can breathe? The casualty must be able to breathe. Clearly, you staying calm not only helps you think clearly, but gives the casualty confidence, which is a vitally important part of their well-being. Don't add yourself to the casualty list. Stand back and look for any signs of danger before going to help the casualty. Always leave the casualty exactly where they were found until a suitably qualified person decides on when and how they should be moved. You don't want to make a bad situation worse. However, there may be special circumstances where moving the person may genuinely be necessary. For example, a building collapsing, drowning, fire. To check if someone is conscious, you need to see if you can get a response from them. Gently shake their shoulders and speak loudly and clearly to them. To evaluate a person's level of consciousness, VAP them. Do they respond to your voice? Are they alert, obviously conscious, or not? Do they respond to pain, for example, if you pinch the back of their hand or earlobe? As you know, oxygen is vital to life, and if someone's airway is blocked, they may not take in enough or any oxygen. Their airway could become blocked for various reasons, including, for example, asthma, blood, dentures, facial injury, hanging, strangulation, swollen throat, their tongue obstructing their airway, vomit. To open a person's airway, if you can see something in their mouth which is blocking their airway, remove it. Be careful not to make the problem worse. Gently tilt their head back and lift their chin up gently with your fingers. Since neck, spine, or skull injuries are possibilities, the benefits of being properly first aid trained, which would help you deal with such a situation, speak for themselves. Just because the airway is clear doesn't necessarily mean the person is breathing. If you're sure their airway is clear, you should look, listen, and feel for signs of breathing. For example, does their chest move up and down to show signs of breathing? If you place your cheek near their mouth, can you feel or hear any breath? If they're not breathing, mouth-to-mouth resuscitation may be necessary, and you should attend a proper first aid training course to practice, perfect, and prove knowledge of the technique for giving mouth-to-mouth resuscitation properly. Do not attempt to do so without proper training. CPR stands for cardiopulmonary resuscitation and consists of a combination of breaths and chest compressions. The breaths simulate breathing to get oxygen into the casualty's lungs. The chest compressions simulate a heartbeat to circulate blood around the body. Only a properly trained first aider should give CPR. If that's not you, you might make a bad situation worse. In certain situations, a person's heart may need stimulating or its rhythm correcting back to normal. This is done with a machine known as a defibrillator, which gives controlled electric shocks to a casualty. You must never use a defibrillator unless you've been specifically trained to do so. Once you are sure the casualty is breathing, you need to check for other injuries which may or may not be obvious. If the ill or injured person is able to talk, ask them what has happened so you can make some sort of judgment on how serious their injuries are. However, if they're not able to talk, you can feel for and look for signs, such as, for example, abnormal body temperature, abnormal skin colour, bleeding, bruising, burns, circumstantial evidence such as an empty pill container, distressed breathing, groaning, incontinence, loss of normal movement, muscle spasms, painful expressions, swelling, sweating, vomiting. When examining someone, start from their head and work down towards their feet, and prioritise to tackle more serious injuries first. See if there is any tenderness or swelling, blood soaking through clothing. Simple things such as whether the casualty can move their arms, legs, fingers, toes are possible indicators of a problem. Also, stay observant for alert bracelets or neck chains that may indicate the person is diabetic or has a particular condition. One of the most useful techniques to know is the recovery position. The recovery position helps to keep the airway open whilst waiting for professional help. Straighten out their legs. Place the arm which is nearest to you at a right angle to their body, with the elbow bent and the palm facing upwards. Take their other arm and hold their hand in place against the cheek that is nearest to you. use your other hand to grasp their furthest leg just above the knee and pull it up until their foot is flat on the floor. Keep your hands in place and pull on the leg so that they roll on their side. Move their bent knee so that the knee and hip are both at right angles. Check that their airway is still open. If the individual's neck or back might be injured, the recovery position should not be used. Circulation is the process of blood moving through the body to deliver oxygen from the lungs, and as such is a vital part of life. Knowing how to find an individual's pulse is a helpful skill in health and social care. Therefore, to check a pulse inside the wrist, don't use your thumb. Instead, use the pads of your index and middle fingers held together as shown here. The pulse should beat about once every second. Practice doing this on colleagues to find where the pulse is. To check a person's pulse in the neck, don't use your thumb. Place the pads of your index and middle fingers together in the hollow between the windpipe and large neck muscle at the side of their neck. This is the easiest pulse to find on an adult casualty. Practice doing this on colleagues to find where the pulse is. If circulation has failed, then they are very likely to have stopped breathing as well, and you will need someone to administer CPR. Undoubtedly, one of the most important first aid resources is the first aid box. All care settings must provide adequate first aid facilities, including a well-stocked, readily accessible first aid box or boxes. Everyone working in your care setting must know the location of the first aid boxes, which should be easily identifiable as green with a white cross on the front. A first aid box should always contain at least a guidance card on emergency first aid, a number of individually wrapped sterile adhesive dressings of various sizes, 2 sterile iPads, 4 individually wrapped sterile triangular bandages, 6 safety pins, 4 medium-size individually wrapped wound dressings, 2 large-size individually wrapped wound dressings, 1 pair of disposable gloves, scissors, tweezers, cotton wool. Never keep medication, creams or ointments in first aid kits because of issues relating to the administration of medicines. Ideally, a qualified first aider should be appointed to regularly inspect the first aid box to make sure that it always has everything in it that it should have, and that the contents are replaced when necessary. It's worth reflecting upon how people may react after a first aid situation has arisen. Some people feel emotional after dealing with an incident, and they may experience, for example, doubt, sadness, satisfaction, uncertainty, worry, feelings of guilt, shock, sleeping problems. If any of these arise, you should talk to your manager and see your doctor. In all health and social care situations, infection control is an essential component of good practice, and not surprisingly, this extends to first aid situations as well. Obviously, wearing disposable gloves, good hand washing practices go without saying. In simple terms, a dressing is any appropriate item intended to cover a wound, which should only be applied by someone properly trained to do so. There are dressings, for example, a band-aid or plaster, which are adhesive, and you should remember that some people may be allergic to the adhesive part. Bandages are a type of dressing and have many uses, including, for example, controlling bleeding, immobilizing limbs, reducing swelling, securing dressings, supporting limbs. When applying a bandage, remember, infection control procedures apply. Tell the person what you're doing. Reassure them. Make them as comfortable as you can. Work on their injured side and where they can see you. Support the body part being bandaged. If in doubt, always use a bandage which is too big rather than one which is too small. Always put the lint of the bandage shiny side down. Ensure the bandage is secure whilst not impairing circulation. Wherever possible, leave fingers and toes poking out of a bandage. There are different types of bandages you could encounter or need to use in first aid situations, including, for example, roller bandages, crepe bandages, elasticated bandages, tubular gauze, triangular bandages. Each of these types of bandage has a different purpose, best learned on a formal first aid course. A wrongly applied dressing or bandage is potentially dangerous because it could cut off a person's circulation. Signs that a person's circulation may be being cut off by a dressing or bandage could include, for example, the person feeling their skin is tight and painful, the skin around the bandage becoming blue, the veins beneath the skin becoming prominent, the area around the bandage swelling. If you gently press a fingernail or toenail of the injured limb, when you release, the nail's natural colour should return quickly. If not, the bandage may be too tight, in which case it may need to be loosened or reapplied. Health and social care workers working with people who are bandaged should stay alert for signs of circulation being impaired. Various types of slings are encountered in health and social care settings. For example, arm slings, elevation slings, support slings, wrist slings. The differences become more clear on a formal first aider course. Bleeding could be external, you can see it, internal, you can't see it, or both. If someone is bleeding heavily, you need urgent medical help from the emergency services. You need to stop the blood flow by putting pressure onto the wound immediately. Having the person sit down or lie down and raise the wounded part above the level of their heart contributes to reducing the flow of blood to many types of wound. Since severe bleeding is likely to result in shock, you need to know about and watch out for the signs and symptoms of shock, which we'll come to later. Nosebleeds are a common problem and often dealt with quite straightforwardly. In the event of a nosebleed, sit the person down. Tilt their head forwards. Ensure they breathe through their mouth and refrain from sniffing or sneezing. Pinch the soft part of their nose just below the bridge. A dressing may be necessary to absorb the blood. Stay like this still for about 10 minutes. If it has not stopped, then start again. When it has stopped, clean up with warm water. If the nosebleed is severe, lasts for more than 30 minutes or follows a blow to the head, get them to a hospital. Regular nosebleeds need medical advice. It could indicate an underlying problem.